It was a pleasure to share the stage this morning with Professor Graham Jackson to discuss the utilisation of KRD in the real world. We described two clinical case scenarios of the utilisation of KRD at first relapse in myeloma patients. And I guess the themes that came out of the conversations and the questions afterwards were very much: when do you use this regimen, in which clinical setting, which patients would be suitable, and exploring the toxicities around that regimen. And it was really interesting to hear thoughts from the audience and to canvass questions and thoughts about the toxicities relating to KRD, the efficacy relating to this regimen, and its utility in the real world. And I found it a very thought-provoking discussion. So the toxicities we explored is the utilisation of this regimen in people who've been had previous issues with neurotoxicity in particular, and how that we didn't tend to then see in the real world a worsening of that neurotoxicity. And also we explored the efficacy of this regimen, and particularly the prolonged progression-free survival one can see when utilised in the correct clinical setting, and also the deepened responses you tend to see with this regimen, and how that may then have utility if, for example, in the case study that I explored, and then as a bridge to second transplant, for example.